So the work that I've been doing with Fight Colorectal Cancer really examines a lot of the intricacies of early onset disease and research. And part of the work that we've been really centered around is some convenings around early onset and specifically etiologic drivers. So there was a think tank that was hosted in Barcelona in 2025 in June, and we really started to examine a lot of the areas of interest for research as it related to etiologic research. But coming into this meeting, part of the work has really been to understand more about the perspectives of patients, caregivers, and the community based on their experience as early onset survivors, caregivers. And I really spend a lot of time focusing on a pulse survey to help inform a larger initiative moving forward to understand what were the key indicators and what were the key things we needed to focus on in terms of early onset. And so I would say that really right now, part of the thing is really the awareness of early onset colorectal cancer. Many patients, even providers and caregivers, aren't aware that people can get colorectal cancer as early as 20, 30, sometimes in your teens. People really thinking that it's an older disease. So understanding that awareness, really how to drive understanding of our bodies, discussions about disease, and the idea that cancer could be a possibility is a big part. I think that the other thing that really came forward in our survey and our study results and this pulse information to inform the initiative is that ultimately caregivers oftentimes had no idea about things like clinical trials or even their own susceptibility for disease and the needing for testing as related to germline testing, genetic testing, and really understanding that there could be some connections, not just around drivers we don't know about, but even things like family history.